Hi, welcome back to Body Beautiful. I'm Janelle Marie. I've got Dr. Joseph Mele with me today. We're talking cosmetic procedures. Let's get right to the next one, abdominal rejuvenation. So we've got two things, liposuction, right, and tummy tucks in this?
Yes, those are the main workhorses I have.
Difference between the two, anything real big?
Liposuction just removes fat.
Okay.
So the skin has to be tight, the muscle has to be tight to get the best results. Tummy tuck tightens muscle, tightens skin, and removes fat.
Oh, so
and sometimes we combine them. So the liposuction let me reach a little bit farther around the sides when I'm doing a tummy tuck.
Who's a good candidate for either?
Have to be in good health. Have to have a problem they don't like. I have to be able to fix it. And if it's something where the skin is loose, the muscle is loose, those are fixable problems. The tummy tuck is one of the nicest procedures we have because it lets us control almost everything that causes problems in that area.
Especially the muscles, right? You can tighten those too after you have a baby.
Yes. I mean, you can exercise, get the muscle strong, but if the case the muscle is in is stretched and too big, there will always be some pushing forward of the gut. And when we tighten that up, it's like putting a corset on inside. And then everything else is nice and smooth and flat over it.
Let's see some pics.
Okay.
First pic. Oh, there we go. That's nice.
There we go. So this is liposuction. So this is someone who that fullness in the lower body is caused by fat.
Oh,
so
that's all fat,
her muscle is actually nice and smooth underneath there already, and that's the perfect candidate for lipo. Tight skin, tight muscle, good health.
So that was
sneak in through little,
nice
half a quarter inch incisions and suck that out.
What was the downtime on that?
It's sore first couple days. Usually by the end of the week, people are good.
Yeah, not bad.
I'll slow them down a little bit in terms of real vigorous exercise just to keep it from swelling, but in terms of walking, talking, doing normal stuff.
And you can tell.
Quick.
You can tell whether they need just fat sucked out or
well,
muscle
if I see it in person, I can't.
Oh, okay.
Because it's that pinch test.
Yeah, the pinch test,
If I pinch there and there's fat underneath there that needs to be removed and the skin has good tone, then I'm happy.
What about this?
So here I did a mini tummy tuck.
Oh,
so it looks very similar to the last patient in that there's just fullness at the bottom. But if you look below the belly button, there's a little bit more of a curve there.
Yeah.
The muscle's actually been stretched out and the abdominal contents are pushing out a little bit there. And there's a little bit more loose skin. So this is someone, if you did liposuction, there'd be a mild improvement, but that skin that's shadowing underneath would probably be more wrinkly, and it would still be a little full underneath.
So tightening the muscle,
getting rid of the extra skin makes all the difference.
Recovery time on that?
A little bit longer because we're tightening muscle. It's usually sore for a week or two.
Okay.
But
not too bad,
Not too bad. Still
scar
pretty good.
on that one?
The scar is dependent on the amount of skin that's loose.
Okay, so you can do a small scar or a big scar.
So in that case where it's just loose in the middle, I keep the scar to the middle. If it's loose all the way around, then we go farther around regardless of whether we're doing a mini or a full tummy tuck. It's just what needs to be done. Here's a full tummy tuck.
Oh, wow.
Her belly button is kind of out where everything is the most prominent.
Way out,
So with mini tummy tucks, if I look from the side and it's flat down to the belly button, and then it peaks kind of halfway between the belly button and the pubis, I can do a mini. With a full, I want to see this. I want to see laxity top to bottom.
Yeah.
That way I can tighten all of that up, get rid of the extra skin, and also by pulling in the muscle, it helps enhance the waist. So we get a little more curvature at the waist.
When you do the full tummy tuck, do you redo the belly button? How does that work?
It's usually the same belly button. I make an incision around it to leave it on the abdomen.
Okay, good.
The skin is pulled down kind of like the shade on a window.
Yeah.
Usually the hole where the belly button was is removed along with that skin, and then we make a new buttonhole to bring the belly button back through.
And so the best candidate for that full tummy tuck, would that be a mommy type makeover? Are you looking at those kind of things?
Mommies are probably my most common tummy tucks.
Yeah.
The mommy makeovers or just tighten up the belly because that internal pressure stretches everything out. And also people who've gained a lot of weight and then lost it. Okay. Because it does that same thing.
And liposuction and tummy tucks, can they be combined?
Absolutely.
Oh, okay.
Yeah, there's just one area right above the belly button that we don't want to do them together because it can jeopardize the skin, but on the sides it's perfect.
Gotta go. Oh my gosh, it goes so fast. If you want more information about Dr. Mele, call him 925-943-6353. Check him out on the web, drmele.com. We'll see you next time on Body Beautiful. Bye-bye.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor.